Hi everyone, Coach Alexa here. I donated some blood yesterday, which is something I do every few months, and it reminded me that I get asked every now and again about runners who do similar, about the impact that giving blood might have on your training. So let's have a little bit of a chat about that. So first of all, what are the things in blood? Why would it have an impact on training? So a few different kind of key components. There's obviously a lot more complexity than this because blood is carrying all sorts of different chemicals, nutrients, and goodness knows what around your body the whole time. But the key things that we want to think about from a training point of view, first and foremost, is the overall blood volume. So generally you give around kind of 500 millilitres. So that is 500 millilitres less of blood volume that you have in your body immediately post-donation. You've then got white blood cells, which are a big part of your immune system. You've got platelets, which allow the blood to clot. So if you cut yourself, it's what's going to stop the bleeding. And then the big one that we're most interested in terms of training performance are the red blood cells. So the actual sort of plasma, the blood volume, is mostly water, and this is why they get you kind of downing loads of juice before you donate and afterwards, because one of the quickest ways to make you feel better post-donation is to get that overall blood volume back to where it was again and where our body needs it to be. So one of the reasons why people can maybe feel a bit lightheaded sometimes after donation, and why you definitely shouldn't be doing any training the day when you donate, is that blood volume will be lower. Your body's going to have to work harder to pump it around the body, and you might feel a little bit lightheaded. The white blood cells and the platelets normally bounce back within 2 or 3 days, so they're made quite quickly through our bone marrow, so are turned around with a degree of promptness, which is good and handy for our immune system with the white blood cells. The thing we want to bear in mind, though, is that red blood cells take a lot longer to get back to kind of full capacity where they were previously. And in fact, it's that red blood cell count and how long it takes to get back, which is the reason for the time between donations. So it can take a number of weeks, and there's a few kind of different estimates on this, 4 to 6 weeks in specific studies that they've done on people playing sport, lots of different sports, not just running, and the impact of that post-donation when they've studied their performance. You're normally back to usual level performance within 3 weeks after a donation, but that's because the differences then are negligible, not really noticeable over that final few weeks to get you back up to the level. So one of the things that you need to kind of bear in mind with this really is that impact on the red blood cells. So the red blood cells' key role is to transport oxygen around the body. So you can imagine that that's quite helpful for us as runners, because we like to get our muscles filled with oxygen. That's how they perform well, particularly over endurance distances. So that capacity is going to be reduced for, as I say, noticeably from a sporting performance perspective from around the 3-week mark. So when they put people in labs for those first few days post-donation, 1 to 2 days post-donation, you have around a 9% reduction in your VO2 max because of that reduction in red blood cells. It will take a little bit longer for women to bounce back from a donation than men, because one of the key ingredients in making red blood cells is iron, and women generally have lower iron levels, particularly if you're menstruating. So the flip side of that is that we can encourage our red blood cells, or help our red blood cells bounce back a little bit quicker, if we are a little bit more conscientious about making sure we've got iron in our diet. So red meat is a great source, but also anything that's kind of dark green leafy vegetables, spinach particularly brilliant. So having a little bit of a think about filling with liquid, with all the juice, the lovely juice that they give you post donation, and then for the rest of the day cutting out things that are going to dehydrate you, like alcohol, and then thinking about having plenty of iron in your diet. I mean, it's a great mineral to be eating lots of for performance anyway as runners, because it will help with our red blood cell count and how quickly we can get oxygen to our muscles. But think about just boosting your iron over a few weeks post donation to really help you get back on top form again as quickly as you can. And bear in mind that that is that reason why there is that window for donation. So I think 12 weeks in the UK for men, 16 weeks for women, because they don't want you to be running on a state where you've got constantly depleted red blood cell levels. So if you're donating more often than that, you're never going to be operating at the optimum level of red blood cells in your body, which isn't ideal. I hope that's useful.